I am Dr. Leah Lowrie. I'm a pediatric intensivist. I am the division director of pediatric critical care at SSM Cardinal Glennon Children's Medical Center. I am a professor of pediatrics and the associate chair for quality at the St. Louis University School of Medicine. So any patient coming into the ICU for the first time is scared, and their family. Don't know what to expect because it's such a foreign concept to people, that has to be how I first approach them. And I will often just, I'm a doctor, these are a bunch of nurses, you don't need to know our names right now. You're not going to remember them anyway. We're going to do everything we can to help Johnny or Katie through this, whether it was an elective surgery after surgery or I'm very sorry you were just in a horrible car accident and we're gonna make sure that Katie and Johnny get better. And it's really then going back even 2 hours later. Okay, now I'm Dr. So-and-so. What questions do you have? And there's no question that's too stupid, or no question that shouldn't be asked 14 times. And making that statement up front of you're going to ask a bunch of questions and tomorrow you're not going to have any idea what you asked or what I answered. Ask them again. Medicine in the 21st century is a team sport. It is no longer a doctor and a patient. It is a doctor and an advanced care practice nurse and an RN and a dietitian, a respiratory therapist, and particularly in the hospital, that's true. I think there are still pockets in the outpatient world where your doctor writes you a prescription and you go away, but even that's going to change. At Glennon, the amount of relationship that happens particularly in the ICU among that team of people taking care of the child, it's a very single-minded, patient is the center, and everybody's working for the same thing.